الله إن شاء الله نتكلم اليوم عن موضوع الابليكيشن for the training programs at the Royal College of Physicians in Ireland. I would like to say this application process has changed a good bit in the last few years. Like when we applied for the BST in Ireland previously, it was paper-based, so you needed to print out application forms and appraisal forms and send them that way. There was an online application portal as well, but things have changed a lot. And then over the last maybe 2 years, and even since last year, I think there have been changes in terms of the timing of the applications and the process. So the application used to be around October, November. Now I can see it's by the end of September, you have to submit your application. So if you can see here, this is just a new window on Chrome. I'm just going to put RCPI, and then you can see here the first one here. And I think also in the last years, you could just have a link here and you can apply straight away. Now you need to have an account with the RCPI. So let us try here, and we just go straight into Learn and Develop, and we'll go into training programs, and we'll go into basic specialist training. I suppose it's likely the same for the other one, but I'll just go here now for now. Okay, so if you can see here, the first step towards specialization in medicine, and the RCPI manages all these training programs. So the general internal medicine, the general pediatrics, basic pathology, and obstetrics and gynecology. And then you can see here supervised clinical training and so on. I'll just go back to here and see application forms and entry guidance, and then application guidance and frequently asked questions, policies and procedures, and training handbooks. I will recommend that you go through all of these, especially the training handbooks and also the policies and procedures, because if they ask you in an interview in the exam, this is for another time. But if they ask you, and if you're aware of all these, your answers will be quite convincing, and you will come across as somebody who understands the training programs and how all these are organized, not just somebody who's just looking for training without knowing what he's applying for or she. Okay, so let's go for the entry guidance advice. So basically, as you can see here, they are the shortlisting and the interview and the selection criteria and stuff, and that it might be different from one program to another. And then here you can see the key dates. As you can see here, unfortunately, probably you missed webinar support one, but there's another one coming up in 11 days time. And this video is being recorded on the 11th of the 9th, 2025. As you can see here, the application is already open for the BST. And as I said, the second webinar will be on the 22nd of September. And then there are some Zoom drop-in also sessions, which I think are very, very helpful. If you can't attend this one, maybe try to get here. And if you have any questions after attending any of these two webinars, also try to get into these drop-in sessions. The application closes on 29th of September, and application verification completed by 17th of October, and then shortlisting outcomes on the 7th of November. And then successful candidates will be interviewed on this side of New Year, Christmas. So that is a change. Then online interview a date. Sorry, this will be released here, and then the interview dates are almost not very different from previous years. I think they used to happen between September, February, and March. So you can see them all here, all June, January. Ops have 1 day, histopathology and pediatrics have 2 days, and then lots of days, 5 or 6, 6 days for general internal medicine or GIM. Okay, so these are very important dates to keep in mind. And then let's go back and maybe we do 1 or 2 of these specialties, and we can do maybe pediatrics. But before we do that, let us see the entry requirements. As you can see here, it again tells you what to expect, but the entry requirements are general, and then you can see here the procedures. I'm expecting anyone who has done some weeks of internship will have no problems going, like passing through these. And this is for GIM, intravenous cannulation, phlebotomy, nasogastric tube placement. I would expect that everybody who is applying, especially if they have a more than internship practice, they have done a lot more than these. But if you go back up here, you must have completed your internship by the start date of the program. So some people ask us, do I have to have a membership completed if I want to apply for the BST? Of course you don't. Even if you are still doing internship, you can still apply. And then you must submit all your application that clearly demonstrates your eligibility for registration with the medical council. So even if you're you're not yet registered with the medical council, but you have your eligibility, for example, somebody who can't register straight away, but they can do press exams. For example, they have passed the press exams and they have the eligibility letter from the medical council, they can apply. And then you have to have a proof competency in the English language, and we will talk about this a bit later. You must be eligible to work in Ireland at the time of application, so proof of eligibility must be provided during the application process. And I would be a little bit worried maybe with this one, maybe if you don't have a work permit or something like this, would that be a problem for you to apply? I don't know, but I'm sure like everybody who's currently working in Ireland should be able to apply. And then this went quickly to a selection criteria. And basically, when it comes to shortlisting and selection, this is also new over the last 2 years, that there are two groups. There used to be more than that. But anyway, there is now includes the Irish and the UK EU nationals, and any holder of a stamp 4. And now stamp 4, say prior to 2014, was given to anybody, any doctor basically used to get stamp 4 for 2 years. And then because there were no training programs were not available to non-nationals or non-EU doctors, and the people used to go and work like locums here and there and do their extended exams like USMLE and other exams, or do the BLAB exams or the Australian exams. So they were dropouts from the public system. So they were doctors registered at IMC, but they're not working regular jobs. So they come in, do 1 or 2 weeks as locums, and then go and study to leave the country, which was fair, because if you're not allowed to get into training programs, then why not? But anyway, so the legislation came in to change all this, and now stamp 4 was not given to anyone unless they complete 5 years. Even some people who had stamp 4 were taken out from. Anyway, so then later came legislation after COVID with a lot of pressure from Trainers for Ireland and other groups. Then came this stamp 4 after 2 years, and also any stamp 4 holder was then considered as in Group 1 as Irish, UK, and EU national to compete same way. So prior to this, even if you had memberships, you did very well in the interview, you still were not offered a job, a training post, unless they exhausted the list of Irish, UK, and EU nationals. Then anybody else comes as Group 2. So basically, after they don't find anyone who's suitable for a training post from the interviewees, then they go to 2. Okay, so what else? Then there's application forms. And these are the application forms. I'll talk about it a little bit later. And then you have your required documents and guidance. This will come in the shortlisting criteria maybe. And then you have your Irish Medical Council registration. So criteria: doctors who have graduated from an Irish medical school and have successfully completed the internship in Ireland. Require supporting documentation to support. So basically, these are the for the trainee specialist register you need, depending on these categories. Then there are some requirements. So basically, if you have done your internship in Ireland, then there's something called a certificate experience, as like an internship certificate. Which is and if you have already completed that, then you can get the IMC intern registration certificate. So doctors who have graduated from an Irish medical school and will complete their internship in Ireland by July 26th. So these are the ones who are still working. You just need the certificate of registration. As I said, doctors who are currently registered with IMC on the general or trainee registered, current IMC registration. Doctors who were previously registered with IMC, then your previous certificate. Doctors who have been, so this is, for example, somebody who came here, registered, and then left the country or withdraw. So you can just submit your previous certificate. Doctors who have been made eligible for IMC registration and issued with an email from the Irish Medical Council, so they also can provide that letter for eligibility. Doctors who have successfully completed their medical qualification in one of the following countries. As you can see, there's Australia, Belgium, Bulgaria, Croatia, Cyprus, Czech Republic, Estonia, Finland, France, Germany, Spain, and so else. A medical degree of one of the listed EU countries. So please note that the RCPI is a separate institution and cannot provide advice on assessing how you get these. So it's your job to go and get these. And then application guidance. Follow the application guidance and frequent asked questions, and all these are available on the other side. Okay, so if we just go back to the maybe application form, link to the application guidance and frequent. As I said, I'll go here and see what's in here. So once you want to know anything, any more steps, you need to go on to your account. So you need to have an account. required. Okay. You know, like, because I think the application form previously was you could apply just with the link without having a RCPI account, but now you have your account. So the general pediatrics, I said it will take you to a page like this, and otherwise, if I just click on this, I'll see if it's still I can access some information. Okay, so there's here application guidance. There's eligibility for is there an application fee? So this kind of general information about this. If there's €100 per application, can I get a scholarship? Scholarship is not necessary. Each trainee is employed by the HSE. So this is another thing that people ask, will I get paid? Will the salary be enough for me to live, for me, for a small family, and so on? Yes, you're paid, same as any other doctor working here. If there's any limit, no, there's no limit to apply for the BST. Should I have my RCPI, MRCPI completed? I just spoke about this, and no, you don't need to, but you need it just for, when you finish your program to get your certificate, you have to finish the RCPI exams within your training programs. So if you missed the application deadline, that's it. You don't need to. You can't apply again. So that's why I advise to apply well in advance. I am due to have certain aspects updated, work visa status, no all information, including AMC status, proof of English language, anything you need to supply. We don't accept any of the supplemental documentation following the close of the application. So you have them all ready, basically. I have not worked in Ireland before. Will this affect my chances of getting a place in the program? It is not necessary to have worked in Ireland prior to this. So I had one of the people who are attending our courses and workshops 2 years ago, who was still an internship in Sudan, and he applied, and that was the only one I heard about who actually applied. Not working here, nothing, but just be careful about the other supporting documentations, but you don't have to have a working experience here. And so if I have so if I made any mistakes, I didn't apply something. I think this came also probably last year. It wasn't clear whether you needed to apply to submit your appraisal forms or not before the deadline. I think it wasn't mentioned, and then some people did not apply and they were not shortlisted, and there was a back and forth. At the end, they were interviewed. I don't know what happened, but basically, you need to have everything completed before the deadline. Can I have or leave sections blank? I think it's better to, like the exam, like essays. If there's anything you can do, just fill it out. There's no negative marking or anything like this, as it happens in some of the colleges and universities. There used to be, certainly my undergraduate medical school, Jazeera University in Sudan, we used to have negative marking for MCQs. So other colleges were lucky you don't have, and then you don't leave anything blank. But for us, you have to be careful. And even when we initially came to Ireland, there was an exam, the Press 2 exam, or Press 2 exam. It used to be called also TRAS exam, TRAS 1. So you needed to also, it was also have a negative marking. So you needed to be careful on this. So I think these are very important kind of general information. And then if you go to the eligibility criteria, have a medical degree recognized by the IMC, be eligible to work in Ireland and provide proof of same, have completed your internship by the start date of the program, be currently registered in the division of the Medical Council, any of them, or be registered, have proof of proficiency of English language, supply the professional contact details of 2 referees in the online application form. RCPI will reach out to the referees to obtain appraisal should the application proceed to that stage. So basically, it looks like now you have to just supply the appraisal or professional contact details, and this can be challenging for some countries and some regions, to have a professional contact details. So basically, their hospital email and stuff like this. I know a lot of organizations outside. If you're stuck, supply whatever email address you have. I prefer, and I advise you to, if you can get any Gmail, it's better than any other ones. Just for email deliverability, from what I know from working in our doctors learning platform and getting emails delivered to our students and our followers. Can I apply to more than one specialty? What is it? It disappeared. What is it? Can I apply? You can apply to more than one specialty. You will incur an application. Of course, every time you apply to a different specialty. For example, some people, they haven't made their mind yet whether they're applying for BST in medicine, in pediatrics, in this and this. So basically, you can apply, but every time you apply to a program, you have to pay €100. Can I join a program without a medical degree? No, of course you can't. Do I need to complete an intern year? You're entitled to apply, but you have to have completed this by the the start of the program, which is July 26. So English language requirements, we'll talk about them in a little while. medical counsel queries, if you have anything like this to ask about. Do I need a referees? As part of the application, you're required to provide the names of 2 persons to provide appraisal on your behalf. The 2 persons must be consultant supervisors from your 2 most recent medical employment posts. Please carefully read the instructions in the application form. The onus is on the candidate to provide accurate contact details for their referees, as mistakes cannot be rectified afterwards. Please note it is your responsibility to ensure that the nominated referee is willing and able to do so via email in a timely manner. So this is really important. Talk to the referees beforehand, because this is very, very important. If they don't know you have submitted their emails, or they know but they're not willing to do this, or you're not sure they will do it, so it's better to find somebody who is willing to do it in a timely manner, because otherwise you will miss the opportunity, and the onus is on yourself. So nobody would be blamed on this. Can my referees be from internship or medical school? This is different. RCPI will contact these people, the referees, the people you submit their details directly at a later period of the application process, and will advise you further. So that's good if they get back to you and say, they haven't replied or something like this. That's good. I don't know if they do it or not. But it's your responsibility to ensure that the person you nominate to give appraisal on your behalf is willing and able to do so via email by the requested deadline. Post-application admissions will not be in a position to comment or respond to queries regarding references, appraisals, and receipt of same. So if you talk to them and say, have you received this? They're not in a position to reply to this. So it's your responsibility to make sure that the referees are willing and can do this on your behalf. And then this is talking about how you apply. To be honest with you, I would be concentrating on the deadline. Make sure you attend one of these webinars or drop-in sessions. You complete your application in full. Read it beforehand. You start now. Even I know the closing date is the 29th, but you start now and try to have it all organized. And if there's anything you need to get, the referees you need to talk to, documents you need to gather, all of these is very important to have them ready well before the deadline. Don't leave it until the last minute. I sometimes do that. Have to admit, but sometimes the system will be overloaded, overwhelmed with so many people doing the last minute applications, and it might not work properly. The deadline might not be extended, and all that things. So make sure you apply or you start your process early. Read all the documents associated with it, and have everything ready. No one else to blame if your application is missing a document or is not complete. And then this is about the scoring. Each specialty has a scoring criteria based on the requirements of the specialty. How will my interview be scored and all that we'll talk about. But basically, I'm going to stop sharing this. I'm going to go back to a so what is it? I'll stop sharing, and then I'll just reiterate what I just said. Make sure you apply well in advance. You have your all documents. You spoke to your referees, and everything is ready. Because it's your responsibility to make sure all that is submitted during your application. I just want to share 1 or 2 things, and these are important. And the reason is because of what we just said about the English language. So this is the last the circular that has been referenced, or the document that has been referenced in the application on the RCPI website, and it was from the HSE. So you can see it here, dated 6th of November 2020. Because people ask, is the English test important? All of these questions, this is for general, for jobs, standalone jobs, and also for training jobs, as you can see here. And most people, who really will be looking for information will be one of these categories. So basically, if you have had completed your English, your medical degree in English from one of the following countries like Australia, Canada, New Zealand, US, and United Kingdom, you just need to provide your medical degree certificate. That would be enough to prove your ability to communicate well in English. Then the second category, say if you're Irish, you did your Irish Leaving Cert, but you did your medical exams, or you did your A levels in the UK, and you went away to study in medical school somewhere else, but was in English. Then you have to provide your Leaving Cert, your A level transcript results, and then a copy of the medical degree and a certificate of confirmation from the university that if you did your medical degree and exams in English only. Then anyone anyone else will have to have a even if you're exempt from English exam for registration purposes, like Sudan, Malaysia, Pakistan, the few countries who are exempt from this, even if you're exempt, you still need your English proficiency exams, which can be IELTS or OET. In the past, it was only IELTS. That was ages ago. Now the OET, and I feel is more appropriate, for medical type exams, because everything is medicine. Letters, results, talk to parents, talk to colleagues, handovers, and discharge letters and stuff. So, and the rest probably from your applications for registration or for employments and stuff. All these have to be achieved in one sitting of the test. You can combine results from different things. Okay, so I will just stop sharing again this, and I had one more thing to share quickly. Where is 8? I'll share this and say. Okay, so again, I have to say, very important that your where is it? Just make sure that you have these dates in mind, and this is very, very important. So we go to shortlisting criteria, and I go to general pediatrics in shortlisting criteria. You see here, this is important to have a look at. Each applicant accepted for interview must demonstrate the following in their submitted application. So during your applications, within your application forms, you have to, the candidate must demonstrate a clear understanding of the specialty of general pediatrics. Candidates must outline what specialty of general pediatrics entails and explains its role within the context of clinical site and how the training program is structured. This is very, very important. There is no excuse. You have to have know this. The candidate must demonstrate evidence of interest in general pediatrics, and they said here beyond what would be expected as a normal exposure during medical school training or clinical duties. So that they want you to have done more than just, I went to medical school, we did this clerkship or sometimes observership or clinical attachment, we attended 2 weeks. No, they want something more. They want you to have done, a presentation, a piece of research, audit, something like this, a grand house presentation, whatever. You have to have some, show some interest, in this. I think this is important for Ireland in particular because pediatric internship is not required from everybody in Ireland. In some countries I know, you have to do pediatric, obs and gynae, medicine, and surgery. This is absolute requirements. In some countries, they do a combination of different things within the specialty. Say for surgery, for example, not necessarily to do general surgery. They can do ENT, they can do plastics, they can do this and that, cardiovascular, whatever, vascular surgery. And in Ireland, it's not required. Only a few posts for pediatric internships are available. So that's why they need to have done a little bit extra in this. And then the interview criteria. This is under the heading of general pediatrics. You can see here undergraduate academic achievement, 6 marks, research publications and qualifications, 10 marks max. And then I'll just provide a little bit of what do you call it, explanation or on this matter, okay? And then you have the clinical acumen and then your professionalism. So this is used to call the behavioral situational assessments, and then the clinical acumen would be your questions about either difficult case, an acute emergency case, and how you deal with that, and then professionalism, how you deal with your colleagues and you deal with parents and maybe patients, in the clinical setting. And then enthusiasm and suitability, that can be assessed, through the things you have done, or according to what you come across as at your interview. Understanding of your pediatric landscape in Ireland. This is very, very important. It's not enough just to go through the documents I spoke about already, but to go and look at the pediatric care model in Ireland, look at HSE, look at the pediatric websites and all these, and this is very, very important. And then the total marks at 10, and then the scoring. The centile scoring, which is where you ranked in terms of your school graduates batch. So did you come on the top 10%? Then you get 6 marks. You come next 20%, and so on. 4 marks, 3 marks, 2 marks. If you can't provide any letter, then you get 0. But if you can take a letter, and there's a letter available on the HSE website, on the RCPI website, sorry, there's a format, you just take it, send it to your university, and they can fill it in for you. You get 2 marks. If they say we don't provide anything, even a letter from your university on a headed paper or whatever, I will try to get one on headed paper, not just an email. But if you can't, then you get an email, and there's no point. There's no hassle. You can just supply it, I suppose. But it's better if you have something well done. If you say we don't do that, you get 2 marks. Still, you lose 4 marks. It's not, but at least you get 2 marks. And then the scoring for the publication. So basically, if you have a publication, then you see, read here. So for example, if you have a full MRCPI before you start, you get 5 marks. So it's not bad. It's not a requirement to start, but if you have it, it's great. And then if you have a PhD or MD or anything like this, it's good to also get you marks. Published international journal here, they only mentioned PhD, but I will of course include anything I have done. Published international journal, first author, you get 3 marks. Presented international conference, international peer review meeting. I thought this was in comparison to this one, if you present it at the national, you get 5 for poster. I thought maybe this is a mistake, maybe you get 5 for the oral and maybe 1 for the poster, but even for international oral, you get only 2. I don't think this is, maybe it's incorrect, maybe, I don't know. Published international journal, you get 2 marks. Published as the first author or joint author. If you're first author, you also get the 2 marks if it's a national. I don't know if this is pushing people to, but it makes sense. Maybe the national first author equals the joint author in an international. So this makes sense. It makes sense. And then case report, peer reviewed, you get 1 mark. So they said here, no marks will be awarded for abstract. So abstract doesn't count. So if you publish an abstract as part of the conference, doesn't count. But at least that abstract is probably have a poster or representation with it, and you get a point for that. And then just have a look at this. You need to supply the exact link to the publication, and your journal must be listed, and recognized in the SAI Mago journal and country rank portal for your publication to be considered. So this is really, really important. Make sure you have all these, read them, don't skip things, don't cut corners, and I wish you all the best in this. We used to do all these sessions a bit late. This one is a bit long. I know I might break it down into 2 sessions and upload them, but it's really important you go through them. And final things I would say, keep your eye on the deadlines. Attend one of these webinars. This is probably same for all other specialties, for medicine and all those, pathology, and also for other people who are doing surgical and ophthalmology, whatever it is, mental health, psychology, psychiatry, training programs. Then attend the webinars, start your application early, get all your documents, talk to your referees, if they have, some countries I know have well structured all these emails, hospital emails, university emails and stuff like that, and some don't. I will try to go with an email that is easy, to kind of for somebody else to type it, not to make easy mistakes like underscores and the same letters and digits beside each other and stuff like this. And I will personally go with Gmail rather than Yahoo or Hotmail for deliverability purposes. We do organize courses for interview if you're go beyond this step. Medical interview is called Medical Interview Mastery Program or Mastery Course, and it's a well-structured course on Doctors Learning Platform that have helped so many doctors to go through, with confidence through those interviews, to pass the interviews, get into training programs, especially if they're compliant with our mock interview service. So I wish you all the best, and I hope this video has been helpful in terms of helping you in your application, and I wish you all the best again, and see you at another video or training program or a course, online course, or your mock interview sessions.